Yali Madad.
Yeah.
My name is Dr. Rashid Ahmed. I'm currently chair of Al Health Service Pakistan. I'm sorry that I cannot address you live because of certain travel issues. I'm currently in northernmost part of Pakistan, a difficult area to access, and we are stranded here, so I have to leave early in the morning so that I'm able to catch flight late in evening from Islamabad. It's about 20 hours drive. Let me give you a small background of Al Khan Development Network, which we all call AKDN, and we are very proud of this network. Now, as we are all aware that AKDN has different arms: social development arm, economic development arm, culture focus, etc. Al Khan Health Services belong to social development arm of AKDN. Now, AKHS does not only exist in Pakistan, but it exists in many parts of the world, especially where the Jamaat lives in developing world. It is involved in direct delivery of healthcare in countries like Afghanistan, India, Kenya, Pakistan, and Tanzania. And at places like Kenya, Syria, Tajikistan, it provides technical assistance to the governments. Now, a small background of AKHSP. The first health institution in Pakistan was established by Imam Sultan Muhammad Shah alayhi salam, which was a 42-bed maternity hospital in Karachi, Kharadar, in 1924. I was born there, and I'm sure people among you who belong to Pakistan, and especially Karachi, were born there too. Today, AKHSP has expanded its services, and now it is running a number of maternal, neonatal, and child health centers, covers primary health care, provides diagnostic services, and curative care. And of course, this mandate differs in different parts of Pakistan, as I'll show you. First of all, let's see what the vision of Al Khan Health Service Pakistan is. It is a leading non-profit, non-governmental, and non-denominational community-based organization that seeks to achieve the highest quality of life in its catchment populations through enhancing their health and well-being. Now, let me clarify a bit over here. AKHSP not only looks after the health of the Jamaat, but largely its mandate is Jamaat. Vision of Al Khan Health Service Pakistan is to foster healthy communities in its catchment population through creating an enabling environment for health enhancing actions, caring and compassionate provision of quality assured healthcare, development of effective and integrated health service delivery systems, and generation of sustainable models of healthy communities replicable across Pakistan. Now, many people would ask, what is this integrated health service delivery systems? This system will be, inshallah, known as AKDN Integrated Health Service, and it has started in countries like Kenya, but it has very small network. In Pakistan, it's a huge network. And what do we mean by integrated health service delivery systems is that a system which looks after all the ranges of healthcare, right from primary to tertiary and quaternary care. And in this system, Al Khan Health Service Pakistan and other health services in other parts of the world will look after the primary care, whereas, and probably some part of secondary care, and tertiary care will go to Al Khan University Hospital, that is AKUH. Now, AKHSP is currently responsible for primary health care in South. South is, when we talk about South in Pakistan, it is rest of Pakistan minus northern areas, which is Gilgit, Baltistan, and Chitral, which we in short call GBC. In GBC, AKHSP has a larger mandate and it takes care of secondary care, health provision also for the Jamaat and sister communities. Whereas for tertiary care, the communities and our Jamaat and other sister communities go to either AKUH if they are able to travel to Karachi or to Islamabad or Lahore, which are in close vicinity of GBC. Of course, the drive is about 22 hours and the aeroplanes and flights usually do not operate. Now, as physicians, we all know what primary healthcare is, so I'm not going to spend a lot of time on these slides, a couple of slides. It basically relates to the main health problems through promotive, preventive, curative, and rehabilitative services. And it reflects socio-cultural and political characteristics of the country and its communities. In short, it is relevant to the socio-cultural environment in which it exists. Promotes application of the relevant results of social, biomedical, and health service research and public health experience. So it actually includes a multi-sectoral approach for development, maximum community and individual self-reliance and participation, integrated functional and mutually supportive referral systems, which I'm talking about. Integrated Acadian health system will inshallah be a model of this integrated functional and mutually supportive seamless referral system across primary, secondary and tertiary care levels. And it basically relies on health workers, including physicians, nurses, midwives, auxiliaries, and community workers as applicable, as well as traditional practitioners. Like in Pakistan, we have DAIs. So they have been now trained as TBAs, which is trained birth attendants, suitably trained socially and technically to work as a health team and to respond to the expressed health needs of the community. Now, in Gilgit-Baltistan and Chitral, which I will now call GBC, Arkan Health Service Pakistan is involved in providing obstetric services, visiting specialists, and there are outpatient clinics, essential pharmacy services, laboratory and X-ray services, ultrasound clinic services, minor and major surgeries, and dental facilities. Now, these are the primary and secondary care facilities which come under AKHSP, and as you can see, there are 136 such facilities, which include primary and secondary care facilities. Now, you'll be surprised to see that if you look at the second last line, there is mention of child care centers. And people wonder, and I also wonder, and I also question, why do these child care centers exist under AKHSP? But these centers were established under the guidance of Imam Sultan Ahmad Shah alayhi salam, and from that time till currently they are under AKHSP, but now probably they will be called ECD centers and they will be jointly run by different service companies. The Jamaati population in Pakistan, this is a 2-year-old data, and in which you can see that the maximum Jamaati population is in Gilgit-Baltistan and Chitral. Karachi is the second, which has about 67,000 Jamaati people living there. Sindh and Punjab and KPK, which is Khyber Pakhtunkhwa, which was earlier known as Northwest Province, only have 14,000 population of the Jamaat. I'll show you some pictures. They will take some time to load. These are some pictures of our facilities in the most remote parts of Pakistan, which are very difficult to access. These facilities largely exist in northern Pakistan, GBC. And look at them. The architecture is very, very local, and communities have actually helped build these buildings. Okay. Now, let me show you some of the achievements which HSP has made in the past 30 to 40 years when it decided to expand its services to the remotest parts of Pakistan where our Jamaat lives. And I'll show you the comparison of the health indicators in developed world and in Pakistan and the areas which are served by Aga Khan Health Service Pakistan. Now, of course, Canada and Sweden are developed countries. The infant mortality is 3 and 5, whereas in Pakistan it is as high as 70. This is 2007 data. HSP's data in 2009 was 20 per 100,000 live births. And now I'm really very happy to say that now it is about 17 to 18. So gradually this rate is dropping down and we are trying to achieve as low as possible mortality rate. This is under 5 mortality rate in HSP served areas in Pakistan and developed world. And you can easily see that there is a huge difference, about 4 times in the mortality rates of the children who die under the age of 5 years. Maternal mortality ratio in Pakistan is very high. 276 mothers die per 100,000 live births, whereas in HSP catchment areas, it was 116 in 2009, and we do not have this year's data, but what data is coming up, it is being compiled, and I'm pleased to say that this is much, much, much lower. But still, we have a number of mothers who are dying as a result of labor-related complications. Immunization coverage in Pakistan in 2007 was 84%. In HSP served areas in 2009, it was 92%, and last year's data shows that it is about 95% coverage in the areas which are covered by HSP, which almost matches the immunization coverage in developed countries like Sweden and Canada. Now, this is the place where I am currently, and you can easily see all over mountains, the broken wooden bridge, and very difficult to drive and cross the river. And underneath this river and on the sides, there are mountains which are about 30,000 feet high. So there is no chance of error. And if there is an error, then people die on these roads. So this is the area which is served by HSP, and it's a very difficult area which is very visible in this photograph. Now, what does HSP do? To do all what we have talked about. It trains community representatives. I'll show you some pictures. It does a lot of health education and awareness. It develops health educators who are based in the communities, and they actually work with the communities. You can see there are girl guides sitting there. They are being developed as health educators, and they go to the communities and actually educate the communities about different health issues. Leadership development, and this time when we went for the appointment meetings, Maulana Hazrat Imam alayhi salam said that whatever we have achieved, whatever we have gained, the experience, the expertise, have a regional resource. And you can see that HSP current is a regional resource. And inshallah, we will expand this. The health professionals work are continuously trained and updated, and you can see the very, very humble setting in which these sessions take place. The people are sitting on the and getting continuing education and are getting updated. Very simple model. Quality assurance is another agenda, and it's a huge agenda. And currently, where I am, we are making training our
Rashida, your voice is cutting in and out now.
Your voice is cutting in and out right now. So if you can repeat the last two slides.
Acha. This one?
Yeah.
This one?
Ensure continuing education of health professionals.
Yeah. Okay. Now this is one of the pictures of continuing education of health professionals. There are very basic facilities which are available, and you can see in this picture that healthcare providers are sitting on the floor and getting educated about and getting updated about recent happenings and whatever is happening for best practices all over the world. So these are the sessions which are very, very regular, and I'm very proud to say that people living in the most peripheral parts of Pakistan, they know what is happening recently and what are the recent guidelines which have been approved by WHO. We make sure that the services provided to the community through HHSP are quality services, and that's why you can see that in the background there are charts which are quality charts, and the quality is regularly monitored. Now we want to certify that HHSP is providing quality health care to the communities it is serving, and inshallah, the first step would be that we'll get certified for ISO 9001, and hopefully in next 5 to 7 years, we want to get certified for JCIA standards. Of course, there is accountability in the system, and our councils at local, regional, and national level, they make sure that whatever HHSP is doing and whatever services it is providing, it is accountable to the community and to the community leaders. Some pictures of providing cost-effective service provision. This is a picture from northern Pakistan again. Okay. Now, let me share with you the goals for future. HHSP will be a part of Acadian Integrated Health System, delivering cost-effective, quality primary health care to the community. This I've talked about earlier, and it will focus on preventive and promotive services, which are more focused on non-communicable diseases. I'm very happy to say that mashallah, we have been successful in controlling infectious diseases. And when Pakistan is number 2 in the polio incidence cases in the world, not a single case of polio has been reported from the population served by HHSP. Similar is the case with other preventable diseases, and HHSP also immunizes communities for typhoid, influenza, meningitis, etc., etc. So now our focus is on non-communicable diseases, which we call lifestyle diseases, and we are all aware what these diseases are. And we want to enhance collaboration with the government and other private partners, and this was the guidance received by delegation when we went for the appointment meetings with Maulana Hazrat Imam alayhi salam. The key objectives which we presented to Maulana Hazrat Imam alayhi salam for the next 3 years are that we will screen women for early breast cancers. We will screen school children, and we want to screen about 30% of children in the area served by us. and then public-private partnership models for some areas, and initiate seamless referral system between AKU and HHSP in Garden. Garden is the area where Darkhana is located. Darkhana, Pakistan is located, and this is the area we are, inshallah, going to start seamless referral system. Now, seamless referral system is a term which is used by Hazrat Imam alayhi salam, and it means that if a patient is not treatable for example, in primary care setting, then automatically he or she should be referred to the next level of care, that is secondary and tertiary. And we want to upgrade our facilities, 10 primary health care facilities. And of course, we really want to make it a sustainable model through creating opportunities for income generation without compromising access. And what it means is that being a service company, HHSP will charge full fee, but there would be cushion for people who cannot afford. And that cushion will come from, or rather currently also it comes from, the remission which HHSP gives and Social Welfare Board through councils. Now, this is the last objective which I sent to Shaheen Jaffer, and I'm sure you know about this, that I was asked this question: how can you help us to make our services better? Currently, human resource is a major area of concern for us. It's very difficult to get qualified physicians like surgeons, family physicians, administrators, nurses, etc. Because first of all, the area is inaccessible, rather difficult, and plus globalization has made it even more difficult for us to recruit people. Secondly, the geopolitical situation in Pakistan makes Pakistan a difficult country and less attractive for the people who are qualified. So I want to make this request that if you can provide us some help for providing services for temporary period, because we want to send our healthcare personnel to AKU and other training institutions for short training, for example, 6 to 8 weeks, since we do not have a replacement for them, because we have very few people serving these areas, then people among you who are available for 6 to 8 weeks, they can cover for them, and they can go for continuing education to AKU. HHSP will definitely provide accommodation for extended period, example, 6 months or 1 year, to cover for shortage on an ongoing basis, if it is possible for you. I know it's a difficult request, but if you think you can help us in this area, it would be a very, very favorable thing. It will be very, very appreciable gesture on your part. And then, as you know, that about 2 years ago, we had a major natural disaster in northern Pakistan, in Hunza, and I went yesterday, and I had to travel in boat. This area is completely cut off from rest of Pakistan. So if you can help us with some financial resources, but in kind, like medicines, etc., it would be a much appreciated gesture. If you have any questions, or if you want to ask something, if you have any queries, you seek any clarifications, please write to me. My email address is with Dr. Yasmin Ali, and Shaheen Jaffer also has my email address. I'll be happy to respond to any queries which you have. Thank you very much. Yes, okay. If you have paper and pencil, my name is Rashida Ahmed, and I work at AKU. So it is Rashida, RASHIDA dot AHMED at aku.edu. So it's rashida.ahmed at aku.edu. Slide which showed that we run about 130 odd facilities which are located in Karachi, Sindh, Punjab, Khyber Pakhtunkhwa. But since we are Jamaati institutions, and our mandate is largely based in Jamaati areas, and the largest presence of Jamaat is in GBC. That's why the largest number of health facilities are located in northern Pakistan.
Right.
In urban areas, we do not have any issues with healthcare professionals. But in these areas, because it's a difficult to access area, and people who go to medical schools and nursing schools from these areas do not want to return to these areas which are less urbanized. And they
Right.
think that because they cannot educate their children in quality health education institutions, they do not want to come back. And of course, there are other problems also. The standard, which is followed by many good quality health institutions across globe. And AKUH is also certified for JCIA. And since Maulana Hazmam's vision is that his murid living in urban Pakistan, like in Karachi, should get similar quality of care like a murid living in remotest rural part of Pakistan. So that's why we want to make sure that the system is accredited for the quality systems, so that we make sure is, I would say, equitable, not equal.
Are finished, and we are very pleased that you took your time to spend with us on a very busy travel commitment. We would have hoped that you were present in live with us, but because of all the problems that you are facing in Pakistan these days and your busy schedule, we thank you so much to you spending your time with us, and we wish you to have a safe trip back home, and we wish you to have success.
Pleasure is all mine, and I'm really happy that I'm able to address you people, but I again apologize that it cannot be live because of various problems which we are facing. We are stranded in this valley.
Right. And we just hope and pray that you achieve success in all your goals and objectives, and you're doing a great seva, and thank you so much.
Thank you, Yasmin.
Hope to see you soon.
Yali Madad.
Yali Madad. Bye.